Going to replace deteriorating composites for teeth numbers 7 and 8. We'll also correct the width discrepancy between numbers 8 and 9. Defective composite has been removed from tooth number 8, as well as any secondary decay. Enamel has been tapered to expose enamel rods. Greater curve wide is placed over number 8. A contra-angle retainer is used to allow the screw end to extend below the occlusal table. The labial portion of the matrix is cut away with a narrow-tipped coarse diamond. What also works well is the very tip of an ET6 8-bladed composite finishing carbide. By cutting away the labial portion of the matrix, two things can be accomplished. Ample access to the prep is achieved, and the matrix can be burnished into rounded contours at the interproximals. Note the excellent isolation. Triad gel from Dentsply is dribbled over the teeth to further secure the retainer. Do this in small increments. Triad gel becomes very hot when it is light cured. Utilizing a small football size 8-fluted composite finishing carbide, the stainless matrix is lightly feathered away with a sweeping side-to-side motion, exposing the mesial contact surface of tooth number 7. Place the appropriate dentin and enamel shades after the bonding agent has been applied. In this case, I used Filtex Supreme Ultras dentin and body shades. Remove the retainer, but leave the matrix in place. It will help guide the ET6 finishing carbide across the labial surface. Helps prevent gouging. The greater curve matrix is pulled free with the aid of hemostats. The distal of tooth number 8 is adjusted so the width will be the same as the width of number 9. Number 8 is completed. We'll now move to number 7. Standard greater curve is placed over number 7. As before, the labial is cut away with the tip of a narrow coarse diamond. One could also use the tip of an ET6 carbide. Once again, utilizing a small football-sized 8-fluted composite finishing carbide, the stainless matrix is lightly feathered away with a sweeping side-to-side motion, exposing the newly completed distal contact surface of tooth number 8. A huge advantage of the Tofflemire technique. The dentist has absolute control in placing the base of the contact as close to the papilla as aesthetically practical. Minimizes the risk of black triangles. As one can see, the bonded contact is easily broken as the matrix slides through and clear of the contact. Further refinements are done with finishing carbides. Tight, smooth contacts are the rule. Completed direct composite restorations for teeth numbers 7 and 8. The greater curve technique, what can it do for you, the dentist? Number 1, superior isolation of the prep. 2, rounded emergence contours can be custom burnished into the matrix. Mylar strips and wood wedges tend to make straight line emergence contours which result in black triangles. And finally, at number 3, absolute control of the contact position against the adjacent tooth.